Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we can see previous year questions, also important questions for ESIC exam preparation. We can see the questions. First question, anterior fontanelle is located between which of the following bones? Options: Option A, frontal and occipital. Option B, frontal and parietal. Option C, frontal and zygomatic. Option D, parietal and occipital. Question: a location of anterior fontanelle. Okay, in which bone? Between which bone the anterior fontanelle is located? And the correct answer will goes to frontal and parietal. It is located between two frontal and two parietal bone. We can see the features of anterior and posterior fontanelle. In that first one, anterior fontanelle, it is also known as brecma. Anterior fontanelle is also known as brecma and it is diamond shape and its width is 3 to 4 centimeter and its length is 2 to 3 centimeter and it close between 18 months of age. Anterior fontanelle is ossify or closure between 18 months of age. This is the features of anterior fontanelle. And next we can see posterior fontanelle. Posterior fontanelle is also known as lambda. Anterior fontanelle is also known as brecma. Here it is lambda and it is triangular in shape and it measures about 1.2 into 1.2 centimeter. That is width is 1.2 and length is also 1.2, or it is half inch width or half inch length. This posterior fontanelle is located between occipital and parietal bone, but in case of anterior fontanelle, it is located between frontal and parietal bone. Okay, and it close between or is ossify between 2 to 3 months of age. Here in our question, anterior fontanelle is located between frontal and parietal bone. Option B is the correct answer. Move on to the next question. 90% of brain growth is achieved by a child at which age? Options: Option A, second year. Option B, third year. Option C, by fifth year. Option D, by 10th year. 90% of brain growth is occurred by a child at the age of. That is the question. Correct answer is by the age of 3rd years or by the age of 3 years. Okay, option B is the correct answer. Move on to the next question. pH of amniotic fluid is. Options: Option A, 4.5 to 5.5. Option B, 6 to 7. Option C, 7 to 7.5. Option D, 7.5 to 8.5. What is the normal pH of amniotic fluid? And the correct answer is it is option C, 7 to 7.5. Normally, the amniotic fluid is slightly alkaline with pH is 7 to 7.5 and the specific gravity of amniotic fluid is about 1.010. The osmolarity of amniotic fluid about 250 milliosmol per liter is considered as fetal maturity. That is, when the fetal maturity occurs, the osmolarity of amniotic fluid goes about 250 milliosmol per liter. Here pH is the question, so the correct answer is 7 to 7.5. Option C. Move on to the next question. Who is known as the father of hand hygiene? Options: Option A, Joseph Lisner. Option B, Louis Pasteur. Option C, Edward Jenner. Option D, Ignaz Semmelweis. Question: the father of hand hygiene. And the correct answer is it is Ignaz Semmelweis is considered as the father of hand hygiene. Option D is the correct answer. The next question. Which of the following day is observed as hand hygiene day? Options: Option A, 5th May. Option B, 5th June. Option C, 5th July. Option D, 5th August. So our question, which day is considered as hand hygiene day? It is on 5th May. Option A is the correct answer. 5th May is the hand hygiene day. The next question, a recommended time duration for surgical hand washing. Options: option A 2 to 3 minutes, option B 3 to 5 minutes, option C 7 to 10 minutes, option D 10 to 15 minutes. So the time duration for surgical hand washing is 3 to 5 minutes. Option B is the correct answer. In surgical hand washing, the hand should be cleaned about 3 to 5 minutes. Okay, but in case of operation and all, especially in ortho case and all, we can wash up to 10 minutes, but recommended duration is about 3 to 5 minutes. Okay. Some important points after hand washing, surgical hand washing, we can see. After hand washing, we have to keep the hands above the level of our elbow in case of surgical hand washing, because the elbow is considered as more contaminated than hands. So the water goes from the tip of the fingers to the elbow. Okay, so we have to wash hands 3 to 5 minutes and keep the hands above the level of fingers, above the level of elbow. In medical hand washing, the recommended time according to WHO, the recommended time for hand washing is 40 to 60 seconds, but minimum we have to wash the hands for 20 seconds in case of medical hand washing. That is also important point, medical hand washing time and surgical hand washing time. Move on to the next question. Which relationship is most concerned to the nurse because of its importance in the formation of personality? Options: option A peer relationship, option B siblings, option C spousal, option D parent child. Question is, among this option, which relationship is most important for the formation or for the development of personality of an individual? Okay, peer relationship is there, sibling relationship is there, spousal relationship or parent-child relationship is there in our option. Among this, which option is more important for the personality development? And our correct answer will goes to option D, parent-child relationship, that is mother or father, that both parent-child relationship will helpful for the personality development of an individual. First option, peer group, peer development is there. Peer group will come after, that is after parent-child. They are when they are going to school or when they are playing time, that peer, same age group. Okay, that will come after parent-child relationship. Also second option, siblings. Sibling relationship also important for the development of a personality, but it will come after parent-child relationship. Sibling means sister-brother relationship. Okay, and next option, spousal relationship, that is husband and wife relationship. This will come later in the life, not in first time and all. Okay, so here for the development of personality, important factor which is needed for the personality development is parent-child relationship. Move on to the next question. What medication should the nurse expect to administer to actively reverse the overdose sedative effect of benzodiazepine? Options: option A lithium, option B flumazenil, option C methadone, option D chlorpromazine. The question is, which is the drug of choice for the overdose sedative effect of benzodiazepine? And the correct answer it is flumazenil. Option B is the correct answer. Flumazenil is the drug of choice for the overdose sedative effect of benzodiazepines. Flumazenil, which completely inhibit benzodiazepine receptor complex. First option, lithium, which is used for the treatment of mood disorders. And third option, methadone, it is used for narcotic addiction withdrawal. Okay, that is methadone. And last option, chlorpromazine, it is a typical antipsychotic medication. The next and last question, a nurse administers an antipsychotic to a client. For which common manageable side effect should the nurse assess the client? Options: option A jaundice, option B melanocytosis, option C drooping of eyelid, option D unintentional tremors. Here the question is, a nurse is giving or administering antipsychotic drug to a client. Examples of antipsychotics are chlorpromazine, haloperidol, clozapine, risperidone, or some examples of antipsychotics. What is the manageable side effect does the nurse assess for the client? That is the question. Among this option, correct answer will come unintentional tremors. Tremors we can manage. Unintentional tremors we can manage among this option. Remaining option, jaundice. Jaundice is one of the serious side effect, but it is not a common in this antipsychotic patient. And melanocytosis, that is excess number of melanocytes, this is not a side effect of antipsychotic. Okay, and last option, drooping of eyelids, this is also not a common side effect of antipsychotic. Okay, so unintentional tremors will come correct answer. This is most common side effect and we can manage. Okay. Side effect of antipsychotics is an important area. There is anticholinergic effect is there. Also extrapyramidal side effect is there. Both are important area. In another one question we can discuss in detail.